we've all heard, I think, of drug-affected baby, drug-exposed baby, neonatal abstinence syndrome. The neonatal abstinence syndrome is, I'll start there, is a baby who has withdrawal symptoms. So abstinence being meaning without. So a baby who has been exposed to opiates and then is as at the time of birth, the placenta's gone, the blood levels begin to fall, and it's as they fall that the baby begins to have withdrawal symptoms. After the short-term effects, I'm handing a baby off to the parents to take home. That baby is not the easiest baby to care for. The baby is still going to have what we call a stress abstinence syndrome. So they do not have, most of them don't have good state control, that they're not able to stay in a mid-zone of attentiveness with a lot of ease. And of course this is variable. The baby, when the baby's hungry, that baby's hungry, and you have to stop what you're doing and feed that baby. They begin to unravel, I'll use that term, they begin to unravel a little bit easier. So they require a little bit more attention to trying to teach them how to have state control, and encourage parents who are dealing with babies who have gone through withdrawal to really learn what that's like, and there are ways to get instruction in that. That probably goes on for 6 months and gets better with time as the baby develops and learns to have some control. For the longer term, we strongly encourage developmental follow-up, because there are no strong predictors that say this baby's going to be fine, even with a normal newborn, not exposed. I think they need to have developmental screening. We've also been finding out babies who are exposed to methadone have a little bit more likelihood of having a lazy eye. So we're encouraging ophthalmologic or eye evaluations between 12 and 18 months of age for the longer term.